focus. Right, so if you've read and understood, considering it communication skills station, kindly begin.
Okay. All right. Good evening. I'm Dr. Kolade. Can I confirm your name and age, please?
Yeah, my name is Victoria. 55. Okay, sorry. My name is Victor. I'm 55 years old.
Okay. Well done, Mr. Victor. Today I've been asked to counsel you for a procedure. So I want to ask, what do you know about your present condition, sir?
Oh, okay, doctor. I know I've had this problem with my swallowing some time now, about 6 months now. So I've had some tests where it asked me to swallow something, and then I was told to come today for another test.
Okay. All right. Thank you, Mr. Victor. So today, the test that I want to do for you today is esophageal gastro and duodenoscopy. So it involves us putting a small pipe, like the size of your thumb, that has a camera in front. So I'm going to put it through your mouth, through your food pipe, to your stomach, and then to the proximal part of the closer part of your small bowel. So that this thing will be able to let us see what is causing the problems, your difficulty with swallowing, pains that you're having, and salivation. So, and then it also gives us the opportunity to take sample, sample from any abnormalities that we see during the procedure, sir.
Okay, that's okay, doctor. Doctor, is it painful?
Yes, it has minimal pain, but we're going to give you take care of the pain. There are two ways that we can use to take care of the pain. We can either spray some drugs that is going to make you not to feel the pain to your throat when we want to pass the tube, or we can give you drugs that will make you feel dizzy, and then so that you won't have pain while we're doing the procedure.
Okay, that's okay, doctor. Is there any risk?
Yes, there are some risks associated with the procedure, but they occur very, very minimally. And you're thank God you are doing it we've done so many in this center, so usually we don't have risks. The risks that can involve include bleeding. So there could be bleeding during those procedure. There can be injury to your teeth that may lead to either your teeth becoming loose or having a tooth loss. Then the worst that could also happen is there could be perforation of the food pipe. So that's the worst complication that can happen. So those are the complications that can occur.
Oh my God, I'm not doing this procedure again, doctor. I think I'm just going to go home now. You mean you're going to injure my food pipe? I'm not doing this anymore.
No, it's the complication that occur, but it occurs very, very rarely. But it's a thing because it can occur, we have to inform you. So because
doctor, how frequently does this perforation occur, please? Because I don't know. I don't think I'm going to do this anymore.
About less than 1%. So less than 1%. So it's very, very rare for it to occur, but it's a possibility that it can occur. So we have to inform you.
Okay, doctor. So why am I always salivating, always bringing out saliva?
Yes, that's because the lumen of the size of the lumen of your food pipe has reduced in size. So that's the saliva that's supposed to be going through your food pipe into your stomach is not going. So that's why you're having so much of it coming out, Mr.
So,
Victor.
doctor, is this cancer? You know, I've been checking online and I've been seeing a lot of things. They say maybe it's cancer. Is it cancer?
For now, we can't say whether it's cancer or not, but this test that I want to do will give us to know where the narrowing is. Then we'll be able to take some sample from that narrowing and or that the abnormal thing that we see, and we'll send it to the lab. So that will be able us to know whether it is cancer or not.
Okay, doctor. So, do I have to stay in the hospital after this?
No, you don't have to stay in the hospital after the procedure. But usually after the procedure, we want you to observe you for about 2 to 4 hours that you are fine. There's no problem before we allow you to go home. But you have to come with somebody that is an adult that's going to stay with you at least for the first 24 hours after the procedure. And you can't operate any machine after the procedure.
Okay. So this thing you said you are going to take from my throat. When am I going to get the results?
Yes, the results it's going to take about 2 weeks for the results to come out. But if we get the result before that time, you will be contacted. So
okay, doctor. So have you seen the test I did? You know, the one I did before I came?
yes, I've seen the test.
Okay, can you tell?
It shows that the size of your lumen, the size of the food pipe, the size of the lumen has reduced in the lower part of it, and that could be what is causing your difficulty that you're having with swallowing, and then the hypersalivation that you're also having. So that's what is where the main problem seems to be.
Okay. All right. Thank you very much, doctor.
Okay, thank you. So
did you ask, will I be awake for the procedure?
You already told me. Yes,
okay.
I asked that question. So you already told me.
And eating around the time of procedure?
Yes.
Oh no, I didn't ask that.
Okay. For the procedure, the morning of the procedure, you won't have to take. You can only take clear fluid before the morning of the procedure, and usually 4 hours before the procedure, you need to stop. 2 hours before the procedure, you need to stop taking anything. But till around 4 hours before the procedure, you can still take clear fluid.
Okay, doctor. What about my antihypertensive drugs? Do I have to take them?
Yes, you can use your antihypertensive drugs in the morning just with sips of water. So you can use your antihypertensive. But I hope you are not on any anticoagulant, any platelet and blood lighter.
No, I'm not.
Okay, all right. So
yes, and avoid the hot drinks for about.
Pardon, ma?
About the hot drinks, avoid the hot drinks for about 30 to 60 minutes after the procedure. Okay, and then at the end, you ask the patient to summarize and then sign the consent form.
Yes, ma'am.
Okay, ma. All right, ma. Thank you, ma.
Okay. Because at the end, you have to, still 30 seconds are left. That's why I asked you.
Okay, ma. Thank you.
At the end, like you have to ask the patient to sign the consent form. So, no, patient has understood. Okay. So if you're done, can we start with the feedback?
Okay, ma'am.
Abbas, can you please?
Yes, well done. Yes, ma'am. Well done, Dr. Kolade. You were able to answer most of the questions, but I think there's some things you need to refine.
Yes.
Like when he said he doesn't want to do the surgery again, I think it's important not to just say, okay, those risks are not common and all that. You need to tell him that it's specialists, people who are very skilled that will be performing the surgery, and then the investigation is crucial to determine the cause of his symptoms, so he needs to do it.
Yes, good.
So those three points have to come out when a patient says, okay, I don't want to do this because of the complications. That's for both OGD and colonoscopy. It's important to be clear on both of them. Then another thing I wanted to talk about is the risks. Another thing you didn't talk about was that of chest infection, risk of chest infection occurring. And then you should have, when you were talking about, okay, you said a camera will be past the size of his thumb. Yeah, some people will say thumb, while others will say 2 pence, which is actually easy to visualize because people's thumb may differ. But most commonly, when you say 2 pence put together, it's easy for the patient to visualize. Then also, you also have to tell him that or her that that it will be relayed on a TV screen, and that he or she can easily see it himself. And if it's not under sedation, he can actually follow what is happening too. Something like that, just to make the patient have to make the patient to be rest assured that the procedure is obvious. Yeah, thank you. And basically, those are the feedbacks I have from.
Good. And from my side, I think it was very good because you asked very slowly and it was very audible and it was very clearly easy to understand. So it was good. Thank you.
May I?
Yes.
Okay, sorry. So I think, yeah, it was very wonderful. He touched all the questions and almost given all the answers. Just a few things. One of them is if I would be at his place and when the patient said that I don't want to go for procedure,
yes,
a couple of things which I would have said. First of all, when I'm telling that there is a risk of perforation, I would have said there is a tiny risk of perforation, which usually doesn't happen, but it's just we have to tell you so that the patient wouldn't get scared. And the second thing I would say, if the patients say, I'm not going for procedure, I would have given him a bit knowledge. If we won't go for the procedure, what can happen?
Yeah.
So just to make him agree. So one thing I would tell, there is a tiny risk of perforation. And second thing, if we won't go for the procedure, then we could have this, like if it's like something serious, then it can lead to death as well.
True.
And that's the one thing which I say. And second thing I would say, when the patient asks about the result, even if we know that the results are going to come in 2 weeks, I would be very safe and say, usually it comes in 2 weeks, but it can take longer.
Yes.
Or sometimes it comes earlier. So we are not sure, but usually it takes this much. So that you should always say it can take longer because sometimes it happens and you should be on the safe side. That's the one thing. We shouldn't say, I wouldn't have said that, okay, it will come in 2 weeks or like before 2 weeks. I would have said, okay, usually it comes in 2 weeks, but it can, plus minus can happen. And the last thing is when patient is asking about the previous support of, barium swallow. So what I would have done is I could have made a diagram quickly just to show that this is narrowing.
Yeah.
That's it.
Good. Nice take home message. Yes. Thank you. So Dr. Kolade, yes, it was very useful. Maybe you can adapt to these as well.
Yes, thank you, ma. Thank you for the
Thank you.
comments.
Thank you.